Okay, my name is Jennifer Corson. I'm going to give a speech on STI infections on the rise. The widest spread incident of sexually transmitted infections that is causing concern is chlamydia infections. The communicable diseases are spread by a host to the carrier that causes this infection. These communicable diseases can be viral or bacterial, but each causes harm to the individual infected. These infections can sometimes be detrimental to the public if spread rapidly and can get out of control if not properly documented or reported. There are many agencies that try to control and prevent the spread of these harmful diseases. One of the types of infections that is probably the most frustrating is the spread of STIs, sexually transmitted infections, in the community. The STIs are the most preventable of any communicable disease. Chlamydia is a bacterium, also known as Chlamydia trachomatis. This infection is usually asymptomatic and requires preventive testing to detect. There has to be reasons why this infection is on the rise, and this is the question. It is our job as nurses to assess, diagnose, plan, and implement and evaluate to find the answer to the problem and intervene on the solution. Many factors come into consideration when looking for answers to this uprising illness. After analyzing the data at hand for the causes, the next step would be to decide at what level does this type of problem fall into. The status dimension strategy for community health nurses is designed to prevent and treat at all early levels of the disease, such as immunizations and screenings. The structural dimension, which is designed to categorize the demographics of the problem and have the leaders of that given community come together, develop a tool, and solve the problem. The process dimension, which evaluates the problem and comes up with and help promotion of the issue and develop ways to prevent promoting health. The statistics, the incidence of chlamydia in the Duval County is on the rise. 4-year documented period of the disease has increased. From the rise from 2005 to 2009, the reportable cases increased by 739 cases. The incidence rate is 184 new cases each year. Prevalence of this disease would be every 632 individuals of risk report the disease out of 100,000 people. Population of Duval County in 2009 was 904,782. The morbidity percentage would be averaging about 0.6 of the Duval County is contracting this infection. If you look at the Florida state, the impact of level, the impact is 17,116 cases in that 4-year period, and an incident of 4,278 new cases each year. The prevalence of the state would be 357 out of every 100,000 are being reported, and a percentage of 0.3% in the state of Florida. This means that the community of Duval County is contracting the infection double the amount of the state. The nation has reported that in 2006, there are 1 million cases reported at the Center of Disease Control, 347 cases per 100,000. This was a 5.6% increase from the research reported in 2005. Most commonly spread infections can go unnoticed by individuals that have been infected. The higher incidence of spreading the disease is with multiple partners. The complaint in men is dysuria and white discharge symptoms. The symptoms do not appear until after 21 days of incubation, so the spread of infection is very easily transmitted. The women can develop infertility and scarring of the uterus and ectopic pregnancies, causing miscarriage and rupture, leading maybe to death. Neonates can also infect it with the conjunctivitis of the eye and possibly cause chlamydial pneumonia. What is being done? There are many organizations in works. Grants are available from the comprehensive STI prevention system that funds the state health department of the STI programs. Found on the Department of Health website, the states that these programs are, is what this Department of Health states. Community-wide, science-based, interdisciplinary approach to STI preventions that include behavioral interventions, medical and laboratory services, disease surveillance, outbreak response, professional development, and STI awareness with education campaigns. That was found on the Florida 2010 profile website. The Bureau of STI Prevention and Control has just implemented an interactive website called Face It Florida, developed for education about the spread of STIs. There are many other programs out there, but most are for after you already transmit the disease. What I'm more in favor of would be, in my conclusion, the way to improve the health outcomes of STIs would be to implement the process dimension, the route of community health. The key is screening and education for this infection, which involves prevention. Prevention is the most obvious way to stop the transmission of this disease. There are many other things available for preventions on the Department of Health website, but I believe that there needs to be more of a focus in high schools where the incident is more come across, and then people of our community could focus more on the prevention and cause a decrease in the incident.